Yes, good afternoon. My name is Lise Weggersen, and this is
Elin Huslende. We work as interpreters and consultants at the Norwegian Assistive Technology Center, which is a part of the Norwegian Labour and Welfare Administration, commonly referred to as NAV. NAV provides interpreting services for people who are deaf, hard of hearing, and acquired deafblind. Our clients receive the services based on their needs and our ability to accommodate those needs. In the interest of creating a service for the deafblind with consistency and equality throughout the country, NAV established the National Consulting Office for interpreting services regarding people with deaf. In the interest of creating a service for the deafblind with consistency and equality throughout the country, NAV established the National Consulting Office for interpreting services regarding people with deafblindness. We are responsible for this office, and our main task is gathering knowledge and creating guidelines in how to handle challenges that may occur during interpreting services. We are the connecting link between the clients, the local interpreting services, and the management of the Assistive Technology Center. Yes, and this is what we want to talk about today. First, we will explain what's in the legal rights of interpreting services in Norway. Then we will see how the pandemic affects the access to interpreting services for people with deafblindness. What challenges did we as a provider for interpreting service face, and how did we handle closeness to the clients during a worldwide pandemic? Yes. The rights regarding interpreting service for people with deafblindness in Norway are defined in the National Insurance Act. Since it is covered in the law, the interpreting services are free of charge for the clients, as long as it is used within Norway. To qualify for this service, you need to have impaired hearing and vision. People with deafblindness have the right to use interpreter services if they can make use of the service. If they can use an interpreter for its intended purpose, which also means that the client needs to have a certain fluency in one of the languages and/or techniques that the interpreter can provide, like Norwegian spoken language, Norwegian sign language, or tactile sign language. An interpreter for acquired deafblind people do interpreting, description, and guiding. If the client can make use of the service, they can order an interpreter and guide in order to ease their everyday life. For example, go to a doctor's appointment, buy food, go for a walk, go to the gym, join family dinners, companies, or meetings at school and work. The interpreter is not an assistant who can do different courses for the clients. The interpreter can describe the environment and interpret between people who cannot speak directly with each other. Hence, the person with deafblindness can perform the task themselves. Although the client has the right to use interpreter service, it is not always we have interpreters vacant and available. So even if the legal rights are good here in Norway, there are still people with deafblindness who are not satisfied with the execution of the law as it is today. As said before, the interpreter service is covered by the National Insurance Act and is therefore a free service for the clients inside of Norway. For some people with acquired deafblindness, we are the only public service they use to get out of the house, which means for some, we are the most important service to prevent isolation.
In the middle of March, from one day to another, we saw that all public services in Norway got shut down, including our interpreting services. At the time, there were several interpreters on assignment, interpreting for people with deafblindness and different events and situations around the country. All events, both happening at a time and those planned, got cancelled. Everybody got sent home immediately. The interpreters guided their clients home, and that was that. We couldn't only grant interpreting services for the deafblind if it were absolutely necessary. They could receive services if it were health-related or to buy food and medicine. But after 6 weeks, the society slowly started to open up again, and we began granting interpreting services to avoid even more time of isolation. Clients could order an interpreter to go for a walk, work out, or meet family and friends in small groups.
When the lockdown happened, one of our first concerns were how to ensure information to the people with deafblindness about the situation. We know it can be challenging for the deafblind to acquire information because of their double handicap. Now published written information on their website. We got information through the news on television, but we didn't know if our deafblind clients would be able to access the information. We didn't have any routines or guidelines on how to inform them about the situation, and that the interpreter services would be restricted for a period of time. But we knew it would have a huge impact on their lives. We didn't have any routines or guidelines for the interpreters either. What should they do? How should they end the assignments? They just had to go home from whatever or wherever they were at the time the lockdown was implemented. When the interpreter left the clients at home, the clients didn't know when they would be able to get interpreter services again. When would they be able to go shopping for food, medicine, or just go out for a walk? We are now working out solutions for this, so we are prepared for a new crisis in the future. Yeah.
Right from the start, we cooperated with an organization that represents our clients to make sure they were updated on our process. At the same time, we collaborated with representatives from each of the interpreter services offices in Norway, from each of the interpreter service offices in Norway. Sorry. Together, we decided quite early on that every regional office would contact their clients. We don't normally contact our clients unless it is to clarify something on a booking they made. But because of the circumstances, we knew they could feel very isolated. We contacted them just to say, "Hi, how are you? Do you have someone to help you with the necessities? Are you feeling okay?" All of a sudden, we were finding ourselves in a situation that demanded a different approach towards our clients. Knowledge we have of the deafblind as a group appealed to our humanity in the situation. We knew many of them would be isolated and felt a need to contact them as a fellow human. The 17th of March, we had managed to create guidelines that were sent to all the interpreting offices in Norway. The guidelines described how to give service for our clients. They included limiting contacts with our clients, yet ensure they were able to purchase the necessities such as food and medicines. Have a dialogue with each of their clients, clarify whether they have other contacts that can assist them as family or friends, or knew how to order food through home delivery, and if they were connected to home services. We wanted to know these things because we wanted to limit contact points for our clients and our interpreters. If an interpreter was their only option, we made an exception from our services and offered to go to shop for them while they stayed at home. But no one accepted this offer. Instead, they wanted to use our services as normal, which is understandable since it might have been their only chance to make contact with another person and their only chance to get out for a walk and a fresh air in these days. Interpreters also got guidelines for safety concerning COVID-19, washing their hands frequently, bring disinfectants with them at all times, bring face masks. They would buy this for themselves and get refunded afterwards from now. At our office, for example, we order a lot of visitors that interpreters could use in case they were going to assignment where face masks made communication difficult. Other offices may have taken other measures to ensure infection control.
Oh. This one?
Sorry, was it a bit early?
Our national consulting office, where we work, has during this pandemic had a great focus on the client group, people with deafblindness, as we know that they can be much more isolated than the other people we interpret for, the hard of hearing and deaf. We have experienced that there has been a need for us to show even more consideration for the clients than we usually do during this pandemic. As a result of the pandemic, the society started on more extended use of digital platforms for meetings, both in private and professional settings. Our experience is that digital meetings are not so accessible for people with deafblindness. And we have started testing a new guiding technique, which we have called digital guiding. The two organizations in Norway for the people with deafblindness have been active in this process. This is very new for us, and we need to have more experience. But the interpreter and guide will describing the screen. And before the meeting starts, they need to make agreements with the client how they will work together so the client can be independent and active in the meeting. We are very excited to see how this will develop.
Yes.
Yes. Okay. Well, thank you so much for the attention. And if you want to contact us, you can reach us at this email address. And that's all from us.
Mm-hmm. Thank you.
Thank you.